On March 2nd and 3rd, 2017, the Canadian Foundation for Healthcare Improvement and St. Michael's Hospital co-hosted a roundtable at the Li Ka-shing Knowledge Institute in Toronto. The roundtable was called Toward Better Health and Care for Inner-City Populations, and its focus was on sharing and learning from examples in healthcare, working in cross-sectoral action to improve health outcomes, care, and value, the so-called triple aim, for inner-city marginalized populations. An underlying theme of the meeting was on the importance of the social determinants of health and how the upstream approach can help these people living on the margins stay healthy, and the recognition that so much about staying healthy is outside of the healthcare system. Evidences tell us that 65% of healthcare costs are directed towards 5% of the population, and how the 5% are people who are often marginalized or disadvantaged. Many are likely to be unemployed, socially isolated, or underhoused. Many have had traumatic experiences within the healthcare system, some encountering racism or feeling a lack of cultural safety, especially within our Indigenous communities. When it comes to health, your postal code matters more than your genetic code. The healthcare system should be exactly that, a system, and it requires a holistic and integrated approach to health and care. It's time to move past the history of simply talking about the importance of social determinants of health, and instead choosing to collaborate to take cross-sectoral action. There are many organizations doing great things in care integration for our most vulnerable populations, and there is creative work underway. Exemplars from multiple care delivery organizations and community health centers across Canada were shared, illustrating practical cases of healthcare system redesign in action. These also point to an opportunity to spread and scale what works so more people and the healthcare system can benefit. During the rich table discussions at the roundtable, some important conversations highlighted key themes in moving this forward. Building partnerships and relationships to ensure everyone is moving in the same direction to engage communities is needed. To promote sustainability of those cross-sectoral programs, measurement and evaluation are vital, but peopleizing the data, we need to understand who the people are behind the numbers, is equally important. Lived experience brings critical evidence to inform disruptive change. This theme was pulled in part from a story of a site success to get their inner city program a peer worker after the program's team requested one as a Christmas gift. The methods and mechanisms, including policy levers that could be used to facilitate spread and scale, included agreement on common indicators across organizations, movement beyond reconciliation to reconciliation, promoting success stories using social media and communication tools, capacity building to help spread what works, seed funding to grow on-the-ground work, breaking down silos, coaching, and sharing and communicating between organizations. An overarching theme was the fact that you can't go to quality and triple aim outcomes without working on equity. We can't do it alone in healthcare, but we can lead. Another key theme was around taking the time to understand the whole of the communities the healthcare system is meant to serve. That it must be a priority to accomplish the better health, care, and value, the triple aim. Treating individuals as people and understanding their experiences, including success stories like peer workers and the individuals working hard to improve the healthcare system. No more for us without us. Finally, actions like sharing key messages with partners, committees, and each other, as well as seeking out new relationships, new partnerships, and collaborations, avoiding the duplication of services and competing for the same dollar, and ensuring the lived experience voice is not only represented but front and center at meetings, are all essential for moving the collective agenda forward. There is a gap between the system and the people the system is trying to serve. In order to close this gap, a trusting relationship must be formed. Collaboration, sharing success stories, and education are all key to working together to get triple aim results. Training needs to be a priority, and knowledge translation of what works needs to be properly done. Partnerships and knowledge sharing will ensure that there is equity amongst the way we work with and serve our most vulnerable populations. This necessity of bridging the gap had those around the table determine that ultimately, those in healthcare needed to stop looking for problems and instead focus on growing cross-sector solutions and action. As Stephen Samus, former Vice President of CFHI and current Deputy Minister of Yukon Health and Social Services said, "Canada has been an international leader in thinking about population health. It's now time to act."